Welcome to another episode of the Your Company Health podcast. My name is Andre Wright, your host. Today we have David Cantor, CEO of Mind and Body Motion Development Centers. David, how are you?
I'm fine, thank you, Andre.
All right, so to get things started, I know we were talking a bit before, but I want you to tell us your story and how you got involved in healthcare.
Well, I was trained as a psychologist, and my particular interest was in pediatric or developmental psychology, basically. And I've always also been interested in the brain behavior developments. So over the years in various settings and in my career development, I became more intrigued about how can we better assess the evolution, if you will, of behavior problems that emerge in the course of one's life. And with that information, how can we also best treat those conditions that we identify? So in my experiences and travels in the course of my career, I had the good fortune to work in various neuro rehab centers, often attached to hospital systems. And those centers are oftentimes multidisciplinary. Oftentimes people come into those hospital settings because they've had a car injury or a head injury of some sort, and they require all kinds of services, medical services, mental health services, allied health services. And I love the idea of this team-oriented approach to addressing a complex problem and set of conditions. Usually these are physical health injuries, as I mentioned. And as I began to do more and more in my private practice work, I'm seeing what I'd call subtler kind of problems, and particularly issues that are already emergent in childhood, things like ADHD, autism, other kinds of learning disabilities, and things that complicate children's lives that oftentimes don't get fully assessed or maybe not fully treated, and they become more and more complicated, leading to children to sometimes abandon get depressed about their self-esteem, and they have low self-esteem, and they sometimes feel that they can't succeed in life. That leads to sometimes turning to crime, sometimes getting involved in other kinds of, things like drug abuse. And so there's an emergent process where if you can identify problems earlier in life that may get in your way with successful outcomes and achieving things, then perhaps a lot of these problems that often plague not only the individual, but plague society. We live in a society where there's lots of growing crime, there's problems with drug abuse, there's problems with healthcare management, all these things. If we can catch these things early, identify them hopefully comprehensively, and then apply hopefully the right combination of treatments and techniques, then perhaps these problems can be avoided. And so it benefits the individual, but also benefits all of us. It helps us to reduce costs, helps us to reduce some of those kind of problems. So that's really I guess the 30,000 foot view of, what got me interested is kind of finding a solution, a better solution to the problems that plague. And mental health problems are now worldwide problems. They've been growing consistently, and we hear about it in the news every day. Why are we having these, mass killings in school systems and in churches? And why are these people doing these terrible things? There's answers to those questions. It's not just putting money into it, though. We have to actually come up with an approach, a systematic approach that makes sense and also has data behind it to show that when you do that kind of approach, you get better outcomes, more success. So that's kind of where I'm coming from in my approach, and I've been working at developing this model of healthcare delivery in a small private practice setting right now. Eventually, maybe it can grow and more people can adapt the approach that we're taking.
Right, right. I know you talk about, ADHD and, autism, mental health issues, but what are your main services that you offer? Talk to us about
Well,
that.
in Mind and Motion Developmental Centers, we've combined some traditional services like mental health counseling services. We also utilize physical therapy, occupational therapy, speech therapy, communication therapy. We also bring in the latest of neuroscience technologies. For example, we use very sophisticated quantitative electrophysiology kind of measures to measure brain function. And we use that information to also adopt techniques to change or manage brain function to make somebody more adaptable. There's a technique called neurofeedback therapies, and there's other kinds of therapies related to helping the brain function better without using drugs, without necessarily relying on trying to use drugs or medications, which number one, don't always work and many times produce adverse effects for people. So we're using the combination of these non-medicinal approaches, if you will, to treat various conditions like autism, like ADHD, and other conditions as well. But also start from the vantage point of saying, what's really the problem here? There can be multiple things that can mimic certain behaviors. Somebody can have an attention problem because they can't process what somebody's saying to them very well. Or maybe they can't do well in school because their eyes don't work real well. And so we look at hopefully as many of the functions that somebody has and say, that's what's, contributing to why this child is shutting down and not performing well in school, or why they get oppositional, or why they have trouble just developing normal types of behavior. So once we have a clear idea of all the elements of what needs to be addressed developmentally, then we bring in these disciplines. And Mind in Motion does that in a team-oriented fashion. We work and foster a culture where we respect everybody's different vantage points from their various professional disciplines. And we get together, we formulate a plan based on all the information we have, and then we begin to work on all these elements together as a team, sharing information, discussing our progress, sharing information with the family so that they can be part of the process. Um, there is truth to it takes a village to get someone to grow and be the best they can be. And so we do that in a professional setting with professionals working with the family as part of that village.
So it would be fair to say that most of your business would come from referrals.
We get a lot of referrals from pediatricians in the community. We get referrals from school systems. We get referrals from other medical practitioners like psychiatrists or neurologists. But we get a lot of people coming directly to us from the community itself, either because they've heard about us or read about us. And many of our services don't require that you go through a physician or another professional. Of course, like I said, we get referrals from them, but people can, in a sense, knock on our door or call us up and say, hey, my child or myself, we've got these concerns, we have these issues, can you help? And that's where we start the dialogue and begin to work from there. Now, we may bring in other physicians or other folks that aren't part of what we offer as a way to help address again, what the concerns are. We don't have everything under our roof, so to speak, but we do combine things, and we embrace other community medical related services for whatever the client or individual might need.
No, that's awesome. And you have that problem that a lot of practices would love to have. As we were talking about this earlier, you're saying you don't have like a patient growth problem. You have your schedule is typically filled up, and you're typically busy. But how do you do that? What are some of the things that you do or you have done to put you in this position?
Well, several things. I mean, like most folks that have been practicing in whatever their health professional career is, we have much of it is done by word of mouth. The fact is that when you do good service for somebody, they go back to their home and they talk to their family members and say, oh, I went to this place and our son got so much better. And they talk to their neighbors. They talk to other people. So over time, over the years, word of mouth has been very important, because at the end of the day, everybody advertises in print media. Everybody puts stuff out there. But when you have a neighbor or you have a friend or you have a family member that speaks highly of you, you tend to trust that. You trust what other people have experienced and what they say. So really, word of mouth has become an important element in our gaining our reputation for what we do and how we do things. I mean, yes, we do put things out on media like everybody else. We put things out on social media. We're also very active in research. So even though we're a private practice group, we publish articles, we make presentations at national and international meetings about our techniques or what we do and theories that we have and things of this sort. That helps to spread the word in the professional community, to also point to us when they have clients that they think can benefit from our services. So again, it's sort of a shotgun approach, I suppose, but really at the core of it, again, if you do good services for people, you will grow, and they will become your best marketers. They will go around and advocate for you, and that's really how things have developed for us.
And David, I completely agree with you because some of, as you know, I'm in the digital marketing space, and most of some of my best customers are referred to me by my existing client base. So,
Right.
and those customers, they're like immediately they're converted, they're ready to go. So I completely understand what you're saying. When you do good work for your patients, I mean, and they will spread the word. That's just a great way to go. So you touched on your technique. So talk to us a little bit more about what's unique about your technique and what separates you from other practices that are doing what you do.
Well, I think the things that we do that it's a little bit different, as I mentioned, is because we're multidisciplinary. In most cases, not all cases, of course, but in most cases, particularly in pediatric conditions, there are several things going on. Sometimes there are dynamics in the home that are creating stress for the child. They do have learning problems, but the nature of their learning problems might involve the fact that their communication skills are not real good, or maybe they do have difficulty paying attention, or maybe they have other functional things that are getting in their way. And so, again, when the child comes to, or when they're brought to a mental health provider and the parent says, for example, my child is oppositional and won't do well in school, and we've tried to push them doing homework 2 and 3 hours a night, and that's not getting us anywhere. You have to take all that, step back and take all that apart and say, what got us here? Maybe there was a problem from the get-go early on that this child does have an attention deficit. Maybe they have other things that haven't been really clearly identified that's getting in their way. And it doesn't help to just bully a child to try to work harder. That just makes them resentful. And so we need to sort of really step back and try to understand what's getting in the way, as I mentioned. And that's what we do with that comprehensive assessment up front as much as we can do. And then what's unique is then bring in a again, a consultative, integrated way, a team, and
Mhm.
say, okay, we've identified that there seems to be a communication weakness. This child doesn't seem to understand things very well or can't express themselves very well. That will also interfere, by the way, with counseling therapy. If this child goes into counseling and they can't express themselves very well because they have a communication deficit, it's going to be very hard for the counselor to get them to talk about things or get clarity about talking about things. So we recognize these are all elements and things. So that's what's unique, is that we're able to have this integrated combination of disciplines. The other thing that we do is a little bit different is we do bring in a neuroscience element to what we do. This is a modern day. We understand now that brain function affects human behavior, okay? And we have techniques and tools that help to evaluate and measure those things, see to what extent they're playing a role. And we also have tools and techniques to help that brain respond better, to process things better without necessarily trying to rely on drugs to try to do that all the time. And as we know, there are benefits of drug therapies. There are also downfalls of drug therapies, and drug therapies do have their place, but we do try to find alternatives to not just trying to rely on drugs or drugs alone to fix mental health problems or other kind of conditions that we come across.
Awesome. Tell us about some big mistakes you've seen healthcare practitioners are making in their business.
There are a lot of things that confront challenges in this day and age for healthcare, and uh, part of it is also the way the healthcare system is reimbursed. That has to do with the insurance industry, and that's another discussion for another time. So from a business perspective, there are challenges that get in the way for healthcare professionals to have more freedom to do things that are more cutting edge or maybe not as well established that still could be beneficial. That's an issue. But I would say that the advice I would give in general is be open-minded. The things that we learn when we go to medical school or we go to graduate school to do what we do, there's always new information. There's always new research. There's always new things being discovered. And I think it's important, and many of us do that, but it's really important to stay on top of the latest information, incorporate that information as much as we can into what we're doing, to make ourselves better providers. And that means learning. Being a healthcare provider, as it does in lots of professions, but it's a lifelong educational process. There's always new things to learn, and always things to learn outside sometimes of what we do within our discipline. The body and the mind is not an island unto itself. There are many elements, as I said, that all contribute to who and what we are and how we operate. And so it behooves us to learn more about, these other kind of systems and functions and abilities that maybe aren't strictly just mental health or strictly just physical health. They all overlap and they all play a role. So I would say allow yourself to keep learning about new techniques, learning about things that are maybe a little outside of your lane that can still have application to what you do. It's all about open-mindedness and sharing your information, sharing your perspective, and working together with other healthcare providers to get an individual to be, as I said, the best that they can be.
Awesome, awesome. Well said. What was the best business advice you've received, if you could think of one that?
Best business advice. Boy, that is very
And how,
difficult.
how has it impacted you?
There are lots of people over the years that have provided advice or given guidance. Some from my own family members, that are in their own perspectives, having been business people. I would not say I am an expert businessman, as most healthcare providers usually aren't. But I do think that it's important for healthcare providers to be successful in what they do. They have to either learn or rely on business people. That's just the nature of the beast. We have to deal with, we are a business and we have to be able to try to run our business optimally and successfully to keep going and growing. So the best advice I would say has always been to, my father used to say to me, find yourself a good CPA, find yourself a good attorney. Make sure that you're doing things that are both the right way legally and the right way fiscally. And it's important to seek those people out and take their advice, and sometimes you bring in a, top-notch or a real well-qualified business consultant. There are lots and lots of business consultants in and around and growing, and many of them are very insightful about how to market yourself, how to best position yourself in terms of managing your finances, in terms of your growth, all of those things. So again, circles back to that one concept: be open-minded, be open to receive information from other people around topics and areas that you may not know that much about. And I've always tried to keep that open mind, and I think for that reason, I've benefited from getting the advice from those kind of folks.
Awesome, awesome. And David, I can't believe we're at the end of our little talk, but I want us to switch gear and talk a little bit about the state of healthcare. What we're seeing in the marketplace is that, a lot of we have DSOs buying up small dental practices, for instance. A lot of private equity firms just buying up these local practices. Why is that? And if you're, say, small private practice owner, how do you deal with or maneuver or survive in this environment?
That's an excellent question. Again, challenge, because as you point out, you have these large entrepreneurial groups buying up small practices, formulating a conglomerate, if you will, and then selling that. What they're really doing, at least from my perspective, is grabbing market share. So the whole idea is, if I have a large or a network of small practices that, in a sense, provide services to 10% of a state or 10% of a region, that's a marketable item that they can sell to a bigger entity, because it's all about money. My concern in that process is it's all about money. It's not necessarily about quality. And so, these people can continue to grow and be very large, but that doesn't mean that what they're doing and servicing for the members of the community are still getting the best results in health care. And so our group, of course, gets approached by lots of those kind of folks all the time. But fortunately, I have good partners that work with me, and we all have the same mission in mind, that we're really trying to provide something unique, something that's high quality. We're still on a growth. We're learning all the time, and we're changing that, but we're not all about just trying to cash in and try to make money or get the best deal on making money and be part of that process. We really do have a focused heart and the interest to get the best quality and trying to do it in a different way than I guess has been traditionally done. And so far, knock on wood, we seem to be on track, and we're meeting that mission.
Awesome, and well said. Because at the end of the day, and you mentioned this, at the end of the day, when you do good work, when you serve your patients, you know, and that's what's important, because they're gonna continue to come back, and they're gonna be loyal to you.
Exactly, exactly, right.
So, hey, David, again, I want to thank you, for dropping in and talking to us. But before we go, how, people are listening and watching, how can they reach your practice?
Well, we're on the internet. You can find us through our website, www.mindmotioncenters.com, just the way it sounds. You can also call into our clinic. Our general number is 678-749-7600. And someone will take your call or leave a message, and we usually have a response that gets back that day to address questions or help provide a direction for whatever we can do to help you out.
Awesome, David. And David, it has been a pleasure. Thank you so much for stopping in again. And until next time, we'll talk soon.
All right. Thank you very much, Andre.